Hi YouTube, Vincent here, also known as the Glow Doc. I'm accompanied by a very special friend today, my good friend Dr. Ebonie Vincent of TLC's My Feet Are Killing Me. Thank you for coming today.
So good to be here.
I wanted to introduce to you the first of a series called glowbossbabes, and I'm featuring and super honored by Dr. Ebonie today. The series will concentrate on women in the workforce as well as sharing their specialties and their journeys. I have an alternative one in medicine, and so does Dr. Ebonie, and that's what I wanted to share today. So Ebonie and I have known each other for quite a long time.
A very long time.
And I think we haven't skipped a beat since we were in high school. Was that when we met, high school?
Yeah, so I call Therese because I met her in high school. She now goes by Marie, so it's kind of this thing. But anyway, we met when we were like 13, 14,
14 playing volleyball.
Playing volleyball.
Yes.
Yeah, that's where we first met, on the court. And that's kind of a really big instrumental bond that we have, I believe. Absolutely. Because we have similar journeys, but everything that's like embedded within our drive kind of comes from sports, I think.
Absolutely. Determination, endurance, and motivation.
Right. Mm-hmm. And so like when we connected, it was just kind of like, oh, this makes sense that you're kind of in the same vein of profession as me, and like we're kind of had these similar life tracks, and we kept on like being like, oh, me too, the whole, professional climb. So
I think for being student athletes too, we played varsity volleyball at Temecula Valley High School. Go Bears. We definitely learned through pain to balance studies as well as overall health, mental health, and just being there for each other. We actually we were in the same prom
limo. Yes,
we were in the same
limo.
prom Humber limo.
Exactly.
And I think in high school, you got best smile. Right? I think you got best smile.
I did.
I got in your book, in our senior standouts. I got most involved in high school. Mm-hmm. So we were very much very active in high school, in government, played varsity sports, and then we went into college, of course. So I wanted to share your journey in the field of podiatry, which I think is very special.
Yeah. So, I mean, like you said, sports was definitely the foundation for us, and I think that it's important to know, as women athletes, it's literally about like the love of the game and the sports and things of that nature, because it's not like there's this pot of gold sitting at the end of the rainbow like there is for some NFL players or NBA players. We literally are in it for the love of the sport, the love of competition, and when sports ends, like the competition becomes now your profession, right?
Yes.
So, I mean, that's kind of how I got into podiatry, because I wanted to continue to be around sports, in sports, this athletic arena.
Yes. Absolutely.
And went to undergrad, graduated with an undergrad in biology, and was on the way, like an orthopedic track. Mm-hmm. I was like, okay, so I guess if I want to be around sports, I got to be an orthopedic doctor. And, when you get older, it's more in your face, like how your life is going to be professionally, right? And so when I shadowed an orthopedic surgeon, everything was cool, everything was what I expected, because we both had ACL injuries.
Yes,
we're very familiar with
that bond.
Orthopedic route. But what was not familiar was the timing, the scheduling, the on-call systems, like all the things that I just was kind of like, I'm not quite sure this part of the profession works for me, Mm-hmm. And at the time, podiatry was kind of marketing itself as a career that was friendly for women who wanted to both have a career, be a surgeon, and also have a life, which includes husbands, kids, entrepreneurial things if you'd like to.
Yes.
And so that really intrigued me. So, I went to an informational meeting, saw that it was a specialty in feet, and I was like, okay, can I just do one part of the body for the rest of my life? And then I started to shadow and know that within the lower extremity there's just so many other things that you can do, and eventually orthopedics specialize in certain things too, like some specialize in the hands, some the shoulder, the knees, and so why not the feet? So that's kind of where my intrigue with podiatry started. Now I'm obviously here with you, talking to you about now what I envisioned back then, which was you know, I'm a professional. I have my practice that I am in right now. There's some entrepreneurial things that I've done with the show, and now, you know, with that opened up all these other new doors. So sky's the limit.
Amen.
Amen.
And we do have some, so sneak peek, we do have some projects coming up in the near future. Please stay tuned. So we touched on some of our educational background. For me, I did college and then a post-baccalaureate. So what I love about EB2 is that you had an alternative route in medicine. So I went from college to a post-baccalaureate at Charles Drew. So they're both UCLA related. And then I went to medical school in the Philippines. So I'm an IMG, International Medical School graduate. And then I did all my clerkships here in the United States. So in the future, I'll share more information in a video on my journey in medicine. But with Ebonie, I know you did a post-baccalaureate too.
Yeah, you know, a lot of times students aren't going straight from undergrad straight into medical school. I mean, it can happen, but most often than not, people are stopping to get an extra degree. Like, I got a master's of biomedical science with a concentration in forensic medicine. And that was at Philadelphia College of Osteopathic Medicine. And that was like right after undergrad. A lot of times medical schools are looking for you to have something more. Just so you can know, just so that you can know, like, you're not gonna get in debt and not actually pass and not be able to pay off said debt if you don't graduate, you know. So a higher level of a master's degree or some other post-baccalaureate program will be that indication that you're capable of performing in medical school. So I'm a big fan of that, because as hard, or the transition from high school to undergrad, if you thought that was hard, the transition from undergrad to medical school is even harder, you know? So for me, I feel like I needed my master's degree. I'm very proud of it, even though I don't use it.
That is amazing.
But yeah, I think that I attribute my master's degree as to why I even found the field of podiatry. Oftentimes I feel like when you're graduating at 21, 22 years old, you still have this like dream of what it's like, right? Like, I just want to go be a doctor, you know? You're not fully realizing all of the things that it takes, all of the kind of career things. And so by doing my master's degree, I was able to shadow a whole lot of specialties I was able to shadow. And one of those fields was podiatry, and that's why I found it. So yeah, I feel like the non-traditional route is becoming a more mainstream traditional route. Like,
ooh, yes, that's so true.
Yeah.
It brings, I think, the applicant maturity as well.
Yeah.
And that you've seen more, you were tested more, if you will, in that field, in that study. And it does bring a lot, not just on paper, but I think life experience too.
Yeah, life experience is huge, especially because, you know, the rates in which people are, I guess, getting into the field of medicine and having so much burnout. You definitely want to be sure that this is something you want to do and that you're passionate about. And, you know, there's no better way to do that if you have a post-baccalaureate program to fall back on, at least, you know. So I appreciate that we went through both the same kind of route. Right. And that's really cool.
Same injuries.
I know. We have so much in common.
We have the alternative route in medicine, which is different. It's different.
Right.
And I think straight out of undergrad, like you mentioned, I like that point, coming out as a young 20-year-old into medical school, I think you kind of have more credibility when you're a little older. As I am, right?
Yeah.
Than another straight out.
I think that the average age, I want to say, in my medical school class was like 27, almost 30.
Oh wow.
Yeah, there was a lot of people that decided that medicine's like their second career. Like, I remember going to class with a guy who used to drive trucks, or someone who was like a whole musician, went on tour in like Europe and stuff, and he was like literally 40 when he started medical school.
Yes.
You know?
Yeah, a classmate like that too.
Yeah.
He was like 40, in his 40s. He was a micro lab specialist. He was a lab assistant of some sort.
Exactly.
And he was top of our class.
Yeah, So I mean, like the non-traditional route is becoming more mainstream, like I'm saying. Like it's no longer probably going to be considered non-traditional.
Yes.
Like you're going to be the anomaly if you're the 22-year-old headed to medical
Yes.
school. You know, you're like, are you sure? Like,
yes.
you know.
I think what's neat too is we're from the same small town, Temecula, California.
Yep.
And also we're a minority group, which I think is really special.
That's huge. Definitely.
We were, I want to say, the only minorities in our volleyball team.
Yep.
Right?
Yeah.
Yes, yes.
I mean, if you set the backdrop, like Temecula was nothing when we first moved here. We didn't have a Walmart. We didn't have a mall. We had like maybe 2 wineries.
Yes, we had 2 wineries.
So one high school.
Absolutely.
We were kind of from the country.
Yes.
Yeah.
And you were she was middle blocker and I was libero, so we fed off each other's positions too.
So I mean, I feel like that backdrop of like just kind of being a little bit alone, you know, and also, you know, isolated from the rest of the world, but then also minorities in a majority kind of scenario. It kind of had that, made us have that fight to make sure that we were going to be successful.
Yes.
You know, I think that we were always not only in competition with ourselves, but just making sure that we wanted to thrive outside of our high school.
Yes, and for any young person watching this, I think iron sharpens iron. Whoever you surround yourself with is very important, right? So
absolutely,
I think pushing each other to study, to advise each other through the growing pains of growing up, and just keeping a tight circle of people in your life is very important.
Absolutely.
Since Ebonie is on the show on TLC, My Feet Are Killing Me, I wanted to ask her a few questions. So to start, how did you get on the show?
It was very bizarre. Just kind of wherein just fate just happened, you know. But it all kind of started with my drive to want to be an independent contractor. I went through 3 years of a surgical residency. Residency was not fun for me. It was very difficult, very challenging.
Yes.
And so during residency, I needed to kind of like pick myself up, you know? And so I started to do daily postings on Instagram and Facebook as a way to kind of reach out to the world, to educate people on what I was learning, and hopefully when people got a benefit from what I was sharing, it kind of made me feel better. So it was this kind of like relationship that I had with people I didn't know online.
Yes,
you
like
know,
community online.
Yes, because like when you're in residency, oftentimes you're like alone, you're on call all the time, like you're sleeping not so much, you're studying all the time, and there's a lot of like giving and not enough like uplifting, you know. And so that was kind of my purpose when I started to do my social media. And then when I graduated residency, I wanted to be an independent contractor, build my own practice from the ground up, and I kind of used social media as that platform to continue to reach out and educate the masses and also educate my future patients.
Yes.
And it wasn't long, like when I first got my job, I got established, made a couple YouTube videos, and also, you know, Facebook ads, continued with my social media. It wasn't too long before one of the producers emailed me and was like, hey, we're making this show about feet. And I was like, nah, no way. Nobody's making a show about feet, so delete. And so they kept emailing. I deleted their email like 3 times, and then one of the managers at the office was like, oh, these people now are emailing me. Like, you should probably just respond, see what they have to say.
Yes.
And I was like, okay, fine. I'll just do like an online thing because I don't want anybody with foot fetishes coming around this office. Like, this is just ridiculous, you know?
Which you've had.
Which I've had, which is weird. You know, like, FYI, podiatrists do not have feet fetishes. We just happen to be specialists of the feet. Okay. Anyway, now that that's cleared up, so I did the Skype interview and with the producers.
Yes.
And they were legit. Like, this is the same production company that has done Naked and Afraid, even though that's not like the most shining one you want to lead with, but they have done really successful shows. And so basically I grew with the production team and kind of creating the show all about, you know, my patients who had come in with like kind of bizarre, sometimes regular.
You with amazing cases.
Yeah.
Recently I saw your episode with your patient with elephantitis, which are huge, like lymphedema
Mm-hmm.
or swelling of
Yeah.
the legs and feet. And it was amazing. And just, I mean, it's a tear-jerker show because it's so emotional, but it's also so uplifting and joyful when they get the procedures done by you. So you're changing lives every day. And it's that daily routine that's affected by your feet and lower extremities.
It is.
So
I think it's giving people a different perspective on how they look at the medicine portion of feet, you know? Like far too often, like people just like neglect their feet, and then this show is kind of shining a light on like, hey, you know, you probably should pay attention, because if your legs are swollen, that doesn't mean you just have swollen legs. You could probably also have a heart condition, or you could probably have a blood clot. It's more of a medical emergency. Like, you can't just neglect the most undervalued portions of your body, because that's a telltale sign of how your overall health is going. And so like explaining that to the producers and kind of how I go about treating my patients and stuff like that kind of created a show where it's more emotionally driven, but it also shows like the wonders of how much we can do medicine-wise, you know? And so it's great. I love being on the show. I love how I've grown in the practice and the show, and I'm just one doctor on the West Coast. I do have a co-star on the East Coast, and his partner, Dr. Sarah and Dr. Brad. And we just kind of tackle America, you know, East and West.
That's amazing. Look at that.
Bicoastal kind of things.
They're chronic and acute ailments, right? So it's the whole spectrum.
It is. Like when the first couple episodes are more realistic, I would say, like everyday kind of, oh, I have a hammer toe, a bunion, like I have this really bad wound, you know. But once the show started getting traction, like people from all over started to email and be like, hey, I really need help. Like, I need to be on this show so someone can help me. And so, of course, the cases are getting more and more extreme. Sometimes I'm looking at these cases like, oh my God, like, I don't know. I will do the best I can, you know? So, it's getting really good. And I'm happy that I'm in a position to help as much or as little as I can.
And you truly do, and you're a natural teacher, and you've taught me so much, and as well as your viewers, I'm sure. So stay tuned to her TV show. So this is the first segment on the Glow Boss Babes. Thank you so much for watching. Please stay tuned to some of our future videos, and hopefully we'll bring in some friends along the way.
For sure.
And thank you so much, Ebonie. You're such an inspiration to women. You're the example of a boss babe.
I appreciate it.
Yes. We've gone through some adversities, some issues, I would say. They're all growing pains.
We're gonna have those on the way. Yes, definitely.
Every path is not completely a straight arrow. You know, it's a lot of challenges that come along the way. So we've experienced some adversity, some triumphs as well, and just a reminder: always celebrate even just the smallest, small wins, the big wins. And I look forward to filming again in the future.
Talks, for sure.
Our future talks. Please tune in to TLC's My Feet Are Killing Me. They're going to be starting their next new season, as well as please follow Ebonie on Instagram. Special thank you as well to our friends over at Temecula Life. They have a wonderful app if you're in the Temecula area for wine recommendations. So please follow their Instagram and their app. Special thank you to Lashes and Beauty at our wonderful location today. They have an Instagram, and thank you to Sandra and Chelsea for letting us film here.